Thanks very much to Bupa for supporting today's session. Always really committed to mothers' maternal wellbeing and health, which is fantastic. Just in way of background, I'm going to be referring today to the organisation COPE Centre of Perinatal Excellence, which is a new organisation and really devoted to emotional and mental wellbeing during pregnancy and after. And it's a great resource and a great place to go to for really tailored information in relation to this period of time, which, as I'll talk to you about now, can present lots of challenges to our emotional health and wellbeing. And that's the website that I'll be referring to as we go through. So first of all, I just want to talk about the perinatal period. It might be a word that you've heard of or not heard of before, but it really refers to that time from really conception right through pregnancy, birth, and the first 12 months after having a baby. That's what we term the perinatal period. It's a time when there's a lot of change, a lot of adjustments. People are quite aware of the physical changes and adjustments, obviously during pregnancy, but they can also occur on lots of other levels as well, and also particularly in that first year when there's lots of adjustments to your life, your relationships, your finances, your identity now as a mother and a father as opposed to an independent person or a couple. So there's a lot of adjustment at this time of life. And with that, there can be a lot of emotional and mental health challenges as well. I just want to also talk about the fact that we often hold a lot of expectations about what becoming a mother or a father or becoming pregnant is going to be like. And often those expectations are shaped by the images around us, the advertising around us, the things we see in the media, the magazines we read, the celebrities with their gorgeous belly babies. But as you'll discover, they are not necessarily those depictions are not necessarily the experience and what actually happens or the reality. But concerningly, quite often, because people have those high expectations, when that isn't their experience or what they experience, they often feel like they're the only ones who aren't coping. And that can often stop people from getting help early. So they're the things we're really going to talk about tonight, and the importance of identifying early signs and symptoms of mental health problems and getting to that help as soon as possible. So let's start with pregnancy, and again, some of the expectations we might have about pregnancy. First of all, I've spent the last X amount of time trying not to get pregnant. I'm ready now, so I'll get pregnant. Some people will realise that it's not. For some people that is the case. They can manage to get pregnant very quickly and easily. For others though, that's not the case at all. And again, I think a lot of people spend a lot of time making sure they don't get pregnant, so you just have this sort of underlying expectation that when you're ready, it's going to happen. It's often far from reality for many people. Often also we think we might be glowing and radiant in pregnancy, again like the magazines and depictions on TV, but reality shows, obviously you have swelling feet, sleepless nights. They're part of the realities of pregnancy, and often people don't expect that. Here's just a quote from someone who talked about her experiences, not only of pregnancy but her life as a new mother. Looking back, I had a completely different picture of motherhood in my mind. Reading all those books and magazines whilst pregnant and watching others, I thought I had a pretty good idea of what motherhood would be like. By the time my second child came along, my expectations were quite different. So what I just want to say is just be aware of your expectations that you might be consciously or unconsciously forming and developing, because the reality is quite different. So as we've discussed, not all pregnancies are planned. Sometimes it's like, oh my goodness, I'm pregnant, fantastic. Sometimes it's, oh my goodness, oh my God, I'm pregnant, not so fantastic. So again, it's very variable from one person to the other. 1 in 4 pregnancies also end in miscarriage, and obviously this can be a very trying and emotional period for people, particularly those who are really trying to become pregnant and had difficulties conceiving. The IVF journey can have lots of anxiety and tension, and we know that IVF treatment can also lead people to experience a higher likelihood of conditions like anxiety and depression during that time. Just also with IVF, quite often people think, well, I don't want to put anything foreign in my body or take other medications. So often people resist, for example, in case they are depressed or anxious, they might not take antidepressants or other treatments. But in fact, the research shows that that can actually help not only with your emotional state, but also increase your likelihood of falling pregnant because you have got a better state of well-being. The other thing is to remember that everyone's pregnancy is different, and I'm sure anyone who's going through pregnancies along the time, as other people will know, it is a very different journey for everyone. So be aware of that, and it's just the way it is. When you also think about the pregnancy period, you're starting to form a new time of coming to terms with the fact that you are going to be now becoming a mother or becoming a father. You have a new identity. You start to think about the implications, having to stop work, or how you're going to manage that. What are the implications on your finances? And also, a lot of people, particularly when you become obviously pregnant, will start coming up and giving you advice about many different things. Sometimes that can be very helpful, but sometimes it might not be so helpful or wanted. So sometimes managing advice also in the postnatal period can be challenging. And again, the COPE website will give you a lot of information about how to manage that along the way. We also know that pregnancy is a time when people are more likely to develop emotional and mental health problems like anxiety and depression. In fact, 1 in 10 women will develop depression during pregnancy, and rates of anxiety are probably double that. So anxiety and depression are very common, and it's important to get help early. If we allow these conditions to become a lot more severe, quite often we know that it can have negative impacts on the development of the baby. So getting help early is absolutely crucial. So in terms of stress in pregnancy, this is completely normal. Just like everyone has stress in life, also that doesn't stop when you get pregnant. In fact, because there's a lot of changes around, it might actually increase your levels of stress in pregnancy. But generally, the difference between stress and anxiety and depression is that when a stressful situation has passed or gone away, your stress levels or feeling of apprehension or tension will also go away. But for some people, that's not the case. And for people going through particularly stressful situations like this, if you didn't plan to become pregnant, you've had previous negative experiences, you might be a little bit more apprehensive or stressed about it. If you've had complications in pregnancy, of course that can bring additional stresses and strains for you. Feeling overwhelmed, having relationship difficulties, all these things can increase your risk of stress at this time. But that's quite different from something like anxiety, which can actually feel quite similar in terms of that overwhelming feeling, loss of control. But the thing is with anxiety, it doesn't go away after the situation or stressful event has passed. So anxiety will consist and persist and obviously impact on your ability to function from day to day. And it's not easy to bring those feelings of or worry or apprehension or those feelings of anxiety under control. Like stress manages to go away on its own, anxiety is more likely to persist and stay there and really persists and impact on your quality of life. Now, there's a range of different types of anxiety disorders that exist. Often we just talk about anxiety generally, but there's actually a range of different types of disorders. So GAD, or general anxiety disorder, is that ongoing feeling of tension and feeling overwhelmed. But there's other disorders that manifest, like obsessive compulsive disorder, for example, when you might develop particularly obsessional thoughts about things like, have I turned the oven off, fear of germs or contamination, and then engaging in rituals to try and alleviate those worrying thoughts or feelings that you have. Panic disorder is another type of anxiety disorder where people might have panic attacks, and in those cases it can be quite frightening and people often feel like they're going to have a heart attack. There's phobias, social phobias, general phobias, where people start avoiding situations which might cause anxiety. And post-traumatic stress disorder is another anxiety disorder we often associate with wartime or war veterans. But unfortunately for some people who might have a particularly stressful or traumatic birth, post-traumatic stress disorder can exist there too. So it's important to be aware of these conditions, look for the symptoms, and importantly get help early. On the other side of anxiety, while anxiety might make you feel very tense and overwhelmed and high heart race and hyper alert, depression is the opposite in a lot of ways. It's people feel very sad or down, they lose interest or pleasure in life, and they often find it difficult to cope from day to day. And as I said, 1 in 10 women will experience depression during pregnancy, and in 50% of cases, women with depression also have anxiety at the same time. So those conditions do coexist very commonly. As I said though, getting help early is really important, and particularly before the baby comes along. If you think about it, once the baby comes, you've got a lot of other adjustments to deal with, so getting help early before the baby arrives is a very important thing to do. And there's a range of very safe and effective treatments, both medical treatments but also psychological treatments, which can really tackle the underlying thoughts and feelings which persist with anxiety and depression. But again, talking with your midwife or your obstetrician sooner rather than later is very important. So let's just talk about birth for a little while now. Often a big focus when you're pregnant is coming and leading up to the birth. And again, it is a time where you might have lots of expectations. You might have a very extensive birth plan, which could be 3 or 4 pages long. My biggest advice here is just letting people think about the fact that although you might have great plans, at the end of the day, things might happen which are beyond your control. So just keeping that in mind in terms of your expectations. While it's important to be prepared and manage your expectations, remember you can't control everything, and there's no one right way to give birth. It'll depend on lots of things: the position of the baby, your own blood pressure, the fetal heart rate. All these things will come into play which are beyond your control, so you really need to take the direction of your health professional at the time. And even if you don't have the experience that you wanted for birth, remember it's not your fault. It's a case of when things happen, it's not, and often people feel really disappointed if birth didn't go the way that they planned, or they ended up having a Caesar that they didn't plan for. It's about, the focus should be on getting the baby out healthily and you being healthy as a mother. So really focus on that rather than having expectations that it's going to go just like your birth plan. Just keep in mind that it's not always able to be controlled. As I said also, if things don't go to plan and you find that you do have a traumatic birth, again there's lots of information on the website about how to manage that, both in terms of your care but also your emotional and mental health, because you will be more vulnerable if that should happen to you. And look, often these things are the things that no one's talking about, so it's important to have these conversations and just keep them in mind. Then we talk about the postnatal period, and of course these are the sort of images that we see and what we hope to experience, that close bonding and attachment, feeling in love with our babies. But again, this is not always the case, and it might take time to develop, and just be aware of that. Again, this is a time of really significant adjustment. So just after you've given birth, you're recovering from the birth, you might be trying to cope or manage with breastfeeding. Again, for some people that seems to be effortless and come very easily and naturally. For other people it's not the case, and it can take a lot of effort and devotion, and considering whether that's right for you depending on the situation you're in. Some people seem to have very settled babies, others have highly distressed babies. Bonding with your baby, we all expect we're going to feel in love with our babies, just like the Huggies ad. Be aware that for some people that might take several months to develop, and that's okay, it's just the way it is. Managing your priorities, managing advice for others, there's all this going on when you've got your new baby, but again it's often the stuff that no one's talking about but you need to be aware of, and just keep in your mind when you're forming your expectations about what having that new little bub and bringing the baby into the world is going to be like for you. And if things aren't going the way you feel they or thought they would be, remember you're not the only one. Here's a quote from someone: "I felt like I was already a failure at breastfeeding and it was not working well, and I didn't want to have to admit to anyone any more failing. I was already feeling a little bond with the baby, thinking that I was a horrible and useless mother." And this is what happens often because our expectations are so high, and because everyone's talking or even pretending it's so wonderful and they're having such a great experience. Often when you're not experiencing that, you can feel like you're the only one, but I assure you you're not. In fact, when we look at stress and the development of stress, we know this is an increasing time of stress, but also we know that mental health problems are even more common in the postnatal period. So in terms of looking after yourself and managing that stress and trying to get things to be as the best that they can for you, establishing really genuine support networks is something I'd really recommend strongly. Be aware of being competitiveness, or people sort of comparing all the time with my baby's doing this, my baby's rolling over, my baby's doing this. It's not a competition. Every baby's unique, every experience is unique. So really just focus on you and developing the best relationship with your baby. Making time for you. There's someone else in your life and you're always going to be putting their needs first. So remember to try and make time for you and work out time with your partner when you can have a break, or with the extended family if possible. And when you do go through tough stages, remember they often pass. Growth spurts, teething problems, sleeping, changes in the baby's routine, these things often do pass. So keep that in mind when you often might feel like you're the only one who's finding it difficult. Most importantly, stop comparing and reach out. Often it's amazing, women will say in mothers groups, once they say that this is the experience that they've had, other people, then that gives them the permission to speak out too and say, I'm also having difficulties coping. Here's another quote from someone: I always liked being in control and being strong. I didn't feel in control after having the baby, and I didn't like admitting even to myself that I was having trouble coping. I had a few other stresses at the time, and I always felt that they were the true cause of my depression. So if you've got a lot going on and you feel like you're the only one and you feel ashamed of admitting, that actually makes the condition worse, because you're actually isolating yourself even more at a time when you need support even more. So again, it's okay, and talking up early is important. We know when it comes to postnatal depression that 1 in 7 women will have postnatal depression. So if you think about the mothers group that you might be part of, that's probably going to be 2 or 3 potentially people in your mothers group with depression alone. And if you include anxiety in there, it could be up to half of the women in your mothers group. So if you're experiencing this, don't think you're the only one. We know statistically in Australia these conditions are very common, even though people might not be talking about it. In fact, around 74% of women who had postnatal depression actually said they didn't seek help until they reached that point that they couldn't cope any longer. We've missed an opportunity to get onto it early if we wait till we can't cope. Getting onto it early is absolutely paramount. The faster you get help, the faster you can get back to yourself and get back to recovery. So being aware of your expectations, don't worry that other people are going to judge you. Other people will be in the same boat, even if they might not be talking about it. Jessica Rowe's a great example and a COPE ambassador, someone who talks about her experience very publicly of having postnatal depression. When you have postnatal depression, you can feel like a failure. I know I did. I felt ashamed of feeling so wretched of what was supposed to be the happiest time of my life. So this is where, again, the expectations, you set the benchmark up here, and when that's not been your experience, not only are you coping with feelings of anxiety or depression, but you also, it's compounding those impacts because you put a lot of pressure on yourself as well, which you don't need at a time. You need support, not extra pressures that you're putting on yourself. So again, coming back to just being aware of your expectations that you might be developing. Anxiety is even more common than depression, also in the postnatal period. And again, the signs and symptoms are common, as we talked about in pregnancy. But it's also very common with people with anxiety to be constantly worrying about the baby, worrying that something might be wrong with the baby. And often people will always be going back to their maternal and child health nurse and saying, I'm still really concerned there's something wrong with the baby. So if you find that you're worrying overly or excessively, that could be a sign of anxiety. So important again of getting help early, and similarly in pregnancy and postnatal depression, there are safe and effective treatments. If you are told that, recommended that you use antidepressants or medical treatments, there are specific treatments that are safe to use both during pregnancy and breastfeeding. And again, the COPE website will provide you and your health professional with those details. But often people think, I can't take anything because I don't want to harm the baby. And in fact, sometimes not getting treatment is not doing anyone any good. So getting onto it early and getting those safe and effective treatments is very important. So in terms of getting help, there is a range of treatments in Australia where you can access both psychological treatments under Medicare and also medical treatments. So these are subsidised by the government. So again, being aware that there are evidence-based, really effective treatments out there that you can use. But again, recovery from these conditions is going to be a lot faster and easier for you, your husband or partner and the baby if you get onto it early. So keeping that in mind, and also if you have private health insurance, looking at your policy around what you're entitled to, because often they do also cover psychological treatments as well. So just in conclusion, I just want to summarise that a few things to keep in mind around the whole perinatal period about having a baby. Being aware of your expectations. Often, as I said, we are thinking and looking at the media, we're looking at all the beautiful pictures around and thinking this is what it's going to be like. That's not always the reality, and it won't be the reality for everyone all the time by any means. But if you are finding it difficult to cope or things aren't going as planned, don't forget you're not the only one. These conditions are common, these stresses are common, but sometimes you might feel like they're the only one because people generally and often don't talk about the stresses. There's also a whole lot of information on the COPE website, not only about the mental health conditions, but importantly, how to look after yourself. how to reduce stress, how to recognise when something's not right, and also ways that you and your family and your partner can support and help each other right through that journey through parenthood. But most importantly, if you are concerned, don't wait till you get to the point that you can't cope. Seek help early and seek advice early. And a great place to start with is getting yourself informed on the website. While you're all pregnant and looking at all the physical stuff, don't forget about your emotional and mental health as well. So just a final comment from Peter Overton, Jessica Rowe's husband. As I wind the clock back and think about what we were about to embark on as parents, I wish I'd known a lot more about our expectations, the realities, and postnatal depression. So it's a lot of information there to guide and inform you on the COPE website. So go to cope.org.au, find out more today, and you can be better equipped and better prepared to look after yourself, but also manage when you're going through stress or identifying early any possible signs of anxiety and depression. So the website's there to provide you with extensive information across each stage of the journey, from conception, IVF, pregnancy, birth, preparing and dealing with birth, and then your first year with a new bub. So I just want to thank Bupa very much today for again allowing us this great opportunity to talk to you. And if anyone has any questions, please don't hesitate to come and see me after the session, and we'd be love to provide you with some more information. Thank you very much.